There's a lot of words and stories and truths and maybe some exaggerations in regards to viruses, vaccines, COVID, allergies, and everything with our kiddos. So I reached out to our friends at Akron Children's Hospital and said, hey, everything going on, spring break's coming up, and I hear a lot of words on what we should do, what we don't need to do. Let's go to Akron Children's Hospital. So joining me live this morning is Dr. P. Cooper White. He is a pediatrician of Akron Children's Pediatric Care Group, and he's kind enough to join us this morning with certainly some insight for all of us parents, grandparents, and guardians. And Dr. Cooper White, I guess let's start first of all, and I know a lot of the children are update, but talk about what you've seen with measles and how we got to make sure that we are updated on our vaccinations there.
Well, as you're probably aware, there's a measles outbreak going on in Texas and surrounding areas, and so that's always a concern. Measles is highly contagious. I'm not aware of any measles currently in the state of Ohio, but it's very important to be vaccinated. Vaccination is the primary way to prevent the spread of measles, which is a highly contagious and concerning virus. It's one that can cause serious disease.
Dr. Cooper White, in regards to vaccinations, there are parents, guardians out there, and I know vaccinations are certainly a choice, but there have been some that have said, well, I don't know about the research for the kiddos in regards to vaccinations, COVID, and some of the viruses put together. What about COVID, and what are the guidelines right now? What can they do as parents, grandparents, guardians in regards to a COVID update vaccine?
Well, the COVID vaccine was kind of an exception. You mentioned research, and the COVID vaccine is one that is different in sort of the vaccine technology, involving the mRNA delivery system. And the research timetable was vastly accelerated because of the huge needs of the pandemic. But it was built on decades-old technology that had been developed for prior possible epidemics. And so it proved to be a highly successful vaccine, saved hundreds of thousands of lives in the United States and many, many more around the world. Children experienced a variety of problems related to COVID in the prior to the vaccine, and the vaccine helped greatly in preventing some of the more serious side effects and problems related to COVID disease in children. And COVID remains among us. It circulates. It's not at a very high level here in the Akron area currently, but the vaccine is still available and still effective. The most recent update was released in September of 2024, and the CDC at the time recommended that everybody eligible get the update. And for those of us who are in our more senior years, the current recommendation is to get a second one. So yes, the vaccine is available. We give it out here at our clinic every day, and it is recommended.
With us is Dr. P. Cooper White from Akron Children's Hospital, pediatrician with Akron Children's Pediatric Care Group. This is the time of the season as well, Dr. Cooper White, where we've got allergy season, and then you got families planning spring break, so you're going to different destinations with different things in the air. So talk about, again, in regards to our children and kiddos, what preventatives maybe we can get in place. And, certainly when you talk about warning signs with allergies compared to also a strong flu season and a cold season that are still out there.
Right. You're absolutely correct. The flu season is still, going on, and the flu can be a really challenging illness. Kids tend to be pretty sick and miserable when they have the flu. Allergies are a little bit different in that they tend not to be quite as sick and miserable. Fevers are not part of allergy presentations, for example, and when we talk about springtime allergies, generally we're talking about pollen. Here in northern Ohio, That tends to be an April thing, but obviously if you're going to other parts of the country, pollen allergy can be an issue that you experience earlier. Say pine pollen in Georgia would be something that might occur earlier than it would here in northern Ohio. So be prepared. If you're allergic, have your medicines handy and do what you can to prevent exposure if that's possible.
Dr. Cooper White, let's go a little bit more into the flu season. I've talked to a lot of adult doctors who stress the importance of, getting the flu shot and taking care of yourselves. What have you seen in the pediatric care this winter? And as you mentioned, flu season is still out there. What have you seen?
Well, most children, when they get sick with the flu, will have fever, congestion, achiness, and those types of things that go on for anywhere from a couple of days up to about a week. And then there's generally another week or so of recovery period where things get better. But there are always children who are at somewhat higher risk who might have more serious disease. And we think of kids with asthma, kids with immune problems, kids with cancer. All of them are at higher risk of having more serious problems with the flu. And I can tell you that throughout this winter, there have been children in our ICU pretty much all the time who've had serious cases of the flu that progressed to pneumonia and respiratory failure and a variety of other, very, very serious outcomes. Children die from the flu, and in the United States, that tends to be a number that is roughly in the 100 to 200 range, and those deaths are obviously tragic. The flu vaccine does prevent usually the most serious outcomes from the flu. Like other vaccines, it won't necessarily prevent you from getting the flu, but we'd like to think that if you've been vaccinated, your chances of having a serious problem are much, much less.
All right. Dr. P. Cooper White with us this morning, pediatrician, I should say, at Akron Children's Hospital. Dr. Cooper White, thank you so much. Let me ask you this. This is in your arena a little bit. Is there anything that I missed out that's important that you would like to convey with our listeners in regards to fighting the different viruses or maybe vaccines or something that's important from your standpoint?
Well, you didn't mention RSV, and I think people think a lot about RSV these days, respiratory syncytial virus. It's a virus that can cause, real significant respiratory disease for our youngest babies, and it's also a problem for older adults, and can result in hospitalizations in those groups. And there's a lot of new stuff available for RSV. There's a passive immunity shot that's available for babies that's been highly effective at keeping them out of the hospital, and there are RSV vaccines that are available for pregnant women and for older adults that can also help prevent serious disease in those populations. So there's a lot going on there.
All right, that's terrific. Dr. Cooper White, thank you so much. Appreciate the time and insight education with us this morning. Really appreciate you spending time with us.
I appreciate the opportunity.